اوكي هلا صار فينا نبلش ماشي الحال. So this is the prepared civilian workshop on first aid. We're going to give you a good show of what's going on when something goes wrong, if you're outside, at home, whatever. We're going to cover the basics, and little by little, we're going to start moving into the more complex issues. And this is going to be part of a series of workshops. So this is the prepared civilian. Later on, we're going to have maybe medic 1, then medic 2, and then the very last one, we're going to go into tactical medicine, which is the degree at which you need timely and appropriate medical aid for someone to live. And it's not a story of life and death that you are dealing with. So that's what we will study at the very last.
Right.
So, what will we talk about? First thing we need to understand is the scene size up. When something happens, adrenaline starts dumping into your blood, your heart rate races, and you start to have a sort of tunnel vision. You start only focusing on what's going on and you forget about the environment around you. May it be the actual cause of the accident that is still not neutralized or hasn't been taken care of, or it might be a danger to yourself. For example, an active shooter or a fire or whatever. Second thing we're going to discuss is are the ABCs of first aid, where we establish our priorities. An introduction to trauma. We are going to see trauma on the surface, and then we are going in other workshops. We'll go deeper into it, trauma in the elderly and whatnot. We're going to cover choking, cardiac arrest, and CPR. Scene size up. So the first thing I need to take care of when I'm at a scene or when I need to intervene is to protect myself from any bodily fluids or from what's going on. This is where the PPE or personal protective equipment comes into play. Personal protective equipment can be a helmet, it can be gloves, like not latex gloves, rugged gloves. It can be boots and so on. Turnout gear for firefighters is one type. And then the body substance isolation from the blood, urine, saliva, all the stories. So then I need to figure out, I need to establish what happened, which is called the mechanism of injury and or the nature of illness, the MOI or NOI. The mechanism of injury mainly contributes to something that is more mechanical in nature, broken skin, broken bones, head injury. The nature of illness is something more medically underlying, for example, asthma, pneumonia, whatnot. We need to figure out what went on so that we can know how to proceed. Third thing is how many casualties are there? One, two, five, 10? Is it a mass casualty incident? Because at the very end, I need to call for emergency services. In the US, it's 911. The civil defense, which does EMS, emergency medical services, rescue operations, and firefighting, is 125. And the Lebanese Red Cross is 140. When I call the medical services, I need to tell them, for example, that there is an accident in this place involving two cars, and we have maybe three patients who are unconscious or unresponsive, and that stuff, so that they know what they need to deploy, how many ambulances they need to deploy, if they need any additional resources, and so on. Because if the ambulances arrive and they find out that you were underrating the the scene based on what you think is going on and not objectively, you're just wasting time. And is it safe for you to help? Remember, the first priority is for your safety. No, give direct, simple commands. If I see someone across the road who is bleeding, I'm going to tell them, I want you to take off your shirt and I want you to wrap it up and apply direct pressure to the wound. If it is safe to help, let's get to work. The basics. We have three rules of thumb that we can follow These make the operations a lot faster and a lot easier, and they keep in mind for us the fundamentals. First thing is blood goes round and round, air goes in and out. Any variation, something is wrong. Second thing is take care of the bleeding and then you take care of everything else. Uh, there is a typo there. I see many people, they take care of the airway and the breathing, and then they see that they're bleeding and they take care of the bleeding later. No, you take care of the bleeding first, then you take care of the airway, you start talking to your patient and whatnot. Three, if something wants to get out, it should get out and stay out. If the blood that's leaving the body has already left the body, I leave it outside. But I apply pressure because rule number one says that the blood should go round and round. If my patient wants to vomit or aspirate anything, this is very some, can sometimes cause airway obstruction. They should let it out. We're going to talk about this further in detail in the coming slides. The ABCs, or CAB. It was at first airway, breathing, circulation. Then they took the C and put it in front of the A and the B. So circulation, control the bleeding with direct pressure. Airway, can they talk clearly? Are you able to understand what they are saying? If it's yes, then there are no worries. No, we're going to look at what the jaw thrust is and other ways of opening the jaw to see if there's a visible obstruction and how to remove it. And the recovery position to aspirate. We're going to look at these in more detail. Breathing. No breathing. We start rescue breaths with something we call the ambu bag. We're going to take a look at it later. Yes, no worries. Some trouble. We're going to start administering oxygen. How to stop the bleed? Direct pressure. This is for like scrapes and scratches and whatnot that are actively bleeding. If I cut myself a little bit with a knife or whatever, I can just apply direct pressure for about 5 to 10 minutes. This is perfectly fine and you elevate the lung. For deep wounds, we are going to use wound packing and direct pressure. Wound packing, it's very painful, especially when the patient is going into shock. We're going to take a look at shock later on, and they're scared. It hurts a lot. And when you tell yourself that's a lot of blood, this is when you use a tourniquet. What you will need is a clean cloth. Formally, you can use gauze that's a 4x4, that's like 8 centimeters by 8 centimeters, or sometimes companies roughly round it up to 10 by 10. A clean cloth is excellent. You can use it from the kitchen or uh, the one that we use to dry our body and just apply direct pressure. Wrapping gauze to close the wound, and for wound packing, we can still take the kitchen towel, wrap it up into a nice thick ball, and stuff it into the wound. And we need tape, safety pins, any securing mechanism. فهلا, we know the principle of how to stop bleeding, but there is something fundamental in our body that can help assist to slow down the rate of bleeding. Let us take a look. This is the human cardiovascular system, and it's very similar to boys and girls. And let us take a look what is going on in terms of pulses. On the head over here, on the head, we have the temporal pulses. How can you find it? When you're sitting down and thinking deeply about something, you sometimes put two fingers just behind your eyes on the side of your head. If you put two fingers there and you focus, you can feel the pulses. This shows that there is blood reaching the cranium. So if there's a bleeding around the head, I can apply pressure to it to slow down the rate of bleeding. In the neck, I have the carotid artery or pulses. I have my windpipe in the center. On either side, left and right, if I take two fingers and I put them under the jaw and I slowly start to push in, I can feel two pulse. I can feel a pulse. That's the carotid pulse. It ensures the blood is going to my head. But don't do them at the same time, or else you will lose consciousness because you're depriving your head of oxygen and blood flow. Over here on the arms, on the inner side of the arms, this is between the bicep and the humerus in your arm. This is called the brachial pulse. The brachial pulse, this is the pulse that we use when we want to take blood pressure to see the high and the low pressures. That's called the brachial pulse. I can take advantage of it, block it off if there is bleeding in my lower hand. And the honey, in the pubic area, the blood supply to the legs. Just before it goes into the femoral artery, I have the femoral pulse. Right there. And we take advantage of this because if there is an injury to the leg, to this part of the leg, what I can do is I can take my knee and put it over here and press against that artery so that the person doesn't lose blood as fast because the arteries in the legs, they are big. The femoral artery is huge. I have under the knee the popliteal pulse. Have the popliteal pulse. On the feet, I have the pedal pulse. Those are centered in the body. Those contribute to the main tissues. In the hand, under the thumb, I have the radial pulse. And on the other side, I have the ulnar pulse. The ulnar pulse is a little bit harder to detect. You need an ultrasound to detect it because it's very faint. But we name them ulnar and radial because of the bones that they travel across. So these are all the pulses, the main pulses that we find inside the human body, and we can take great advantage of them to control the rate of bleeding while we control the bleeding. Now let's see what's going on with the direct pressure. First of all, I need to recognize the mechanism of injury. Was it a knife that caused the injury? Was it a chainsaw or a saw for wood? Is it still on? Do I need to turn it off? I need to put on gloves, body substance isolation, and I need to expose it if I need to. If I'm wearing a trousers and I got injured, I need to take off the pants. We don't take them off from the belt and in a civilized manner. No, we cut them off. We need to gain access as quickly as possible, and we don't care about the wound being clean while it's actively bleeding. My main goal is to stop the bleed. After it has stopped, I clean it with normal saline. We will talk about that in wound evaluation and management later on. We take a clean cloth, fold it into a compact square about the size of your hand, and apply direct pressure. Okay, we're going to elevate the limb so that we take advantage of what gravity can do for us and reduce the blood flow to that area. We're going to have to hold the pressure normally for a neat wound, for a nice wound. It's going to have to take about 10 to 15 minutes to get the bleeding under control, and for it to stop, it needs a good 30 minutes. Wound packing for deeper wounds. Again, identify the mechanism of injury and put gloves. I'm going to repeat these basic things so that they stick inside our head, because when something happens, we tend to go crazy and we forget all the basics. Expose the wound, remove any clothing. I'm going to take the wrapping bandage and I'm going to dispense it from the center. I'm going to make like I'm going to take a long piece, a few centimeters long. I'm going to tie a knot at the end, which will act as a plug. After I do this, I'm going to do what is called a blunt dissection. I'm going to use my fingers to navigate inside the wound what's going on. And the deepest part of the wound, that's where I'm going to put that plug. And I'm going to start packing it tightly. And once it's hard as a rock, if I have any excess bandage, I'm going to wrap it well. If I don't have any excess bandage and I put all the gauze that I have inside the wound, that's not a problem. I'm gonna get another one and I'm gonna wrap it tight. So here I'm exposing the wound, I am dispensing it, and then I'm packing it tight. Now, for a lot of blood, this is when we have an arterial hemorrhage sometimes. An arterial bleeding. Hemorrhage means that we're losing blood very quickly. I need to take care of it just as fast, faster than the blood is leaving the body, or else they are going to die, they're going to go into shock. The muscle tissue will be obliterated depending on the mechanism of injury, and the tourniquet is designed to cut off the circulation completely. And many people might think, what happens if I put a tourniquet, for how long can I leave it, and so on. There's something called the ischemic time of skin and muscle. Ischemic time is the tolerance of different organs in our body and for how long they can withstand being deprived of oxygen. For example, my liver, the heart, the lungs, the kidneys, they can go for a few hours without blood flow, even several days in the correct environment. The brain can only withstand a few minutes of ischemic time, which is why CPR is crucial. We are going to see that at the end. So I can apply a CAT tourniquet, which stands for Combat Application Tourniquet. We're going to see it soon, or the SOFT-T, Special Operational Forces Tourniquet. I use the both of them, but I like the Special Operation Forces Tourniquet more. It's metal and it has more resilience. Not that the cat tourniquet is no good. The cat tourniquet is more for civilian application, more for civilian use, but I use both of them. So let's see the application. I'm going to take it high and tight on the arms or legs. I put it as close as to the junction as possible. I pull the strap very tight, make sure it's snug. I cannot put my fingers between the skin and the belt. And then I turn this windlass. I'm going to take this windlass and I'm going to turn it 3 times only. If I turn it more than 3 times, if greater than 3 times, I risk causing a trauma to the skin. I risk causing trauma to the skin. So don't do it. If you need another one, you put it right above the first one, and then you check the pulse just below the where the tourniquet was applied, based on this one, based on over here. So if I cut my hand over here, I'm going to put a tourniquet right over here, and I'm going to check that there is no brachial pulse. If it's on the foot, I'm going to put the tourniquet over here, and I'm going to make sure there's no popliteal pulse, and so on. The pulse is a great indicator whether or not there is still blood flow or not. Okay. هون على فكرة what happens to the skin, I think it's called necrosis. You start damaging the skin. This is what a real case looks like. I have هون a cat tourniquet. I have a cat tourniquet over here and a special operation forces tourniquet here. But this one, clearly the windlass is not tied. This one is tied and I have the time. The time of application is very important because then I know for how long I'm leaving it there and for how long I have deprived the tissues of oxygen. Well, of course, I used a bandage to apply pressure. Good. فهلا, there's also what we should not do. And these things, we call them contradictions, tourniquet contradictions. Too much clothing. When there is too much clothing, I don't know what's going on. I might think that the tourniquet is tight enough, but The clothing is just giving me that illusion. So I need to remove the clothing and then apply the tourniquet on the skin. Or if the clothing is really thick, the injury is too high at junction, the tourniquet will not go there. If I'm bleeding from the neck, I'm not going to put a tourniquet around my neck. Yani. So if the injury is too high, that's a junction. So what we do is on the junctions, we pack it. So the rule of thumb, you tourniquet the limbs, you pack the junctions, and you seal the box. Sealing the box is when we use chest seals, and we will take a look at that later. Stop the bleed contradictions. If something, a foreign object, is in the wound, whether it's glass, steel, or a bullet round, you leave it inside because it can be stopping something, it can be stopping an artery from bleeding. If you remove the glass or the steel, it might actually, as you're removing it, cut open another vein or artery and start even more bleeding. So if there is any foreign object that cannot be removed or looks too big, you just leave it inside and it will be okay. If the foreign object is part of larger infrastructure, you call it in. Either way, you're going to call it in, but let us think of the paradigm of thinking. If normally they put the escape ladders on the sides of the buildings in the US, for example, sometimes those ladders can malfunction and they can injure someone and they can like cut open someone's leg. You don't do anything. That ladder has to be cut. That part of the infrastructure has to be removed so it's transported to the hospital with the patient and the surgeon can take a look at it. These things, these two normally need medical intervention. Putting coffee. I don't know, but apparently in Lebanon there's this myth that to stop bleeding, you put coffee inside the wound. And I've heard it several times and it's just absurd. This is a foreign object. If a foreign object is not supposed to be inside the wound, then for sure you do not put it inside the wound with the intention of stopping the bleeding. You can cause an infection because coffee, it's a plant. So you can cause some type of bacterial infection or whatever. So just apply pressure and you should be okay. Hello, this is mainly for the biomedical students. They're going to enjoy some of this because these are medical terms that we will see in the field and they're useful for us to understand what's going on. If any of our relatives are doctors and they're talking about these things, we know what's going on. When we're talking about the cardiovascular system, tachycardia is a very fast heart rate. Normally, the heart rate is between 65 to 115. This is the normal. Bradycardia is below 65. That's very slow. Arrhythmia is an irregular heartbeat. But be careful. You need to know the context of these. For athletes whose heart muscle is strong, whose heart muscle gets put under pressure on a daily basis, their heart rate can reach 46 beats per minute and they're totally fine. No issue with that. And then when they train, their heart rate can reach 130 beats per minute, and this is also normal, depending on the lifestyle and the physiology of that person's body. Part of the respiratory system, we have tachypnea, which is fast breathing, greater than 24 breaths per minute. Bradypnea is a slow or labored breathing that's below 12. Apnea, we cannot breathe. Dyspnea is the shortness of breath. We don't feel a full breath coming into our lungs. Let's talk about the airway now. So remember what we first said? Remember, there is all the air in the world to breathe, but limited blood. This is why we are taking care of the airway now, and we took care of the bleeding before. How to establish a patent airway? A patent airway is an open airway. So normally we go from the least invasive to the most invasive. The least invasive is the head tilt, chin lift, which is the first picture over here. And to understand, to get an idea of what's going on when we do this, when someone gets you something that smells delicious, what's the sniffing position? Don't we pull our neck forward to take a sniff of what's going on. This is exactly what the head tilt chin lift is doing. We want to open the airway in that way. And the reason why we call it the sniffing position, when we bring our head forward to smell something that smells good, it is improving the diameter of the trachea. It's opening to its maximum and it's in like a continuous stream. The jaw thrust, that's the second picture, and the cross finger supply, that's the third one. All of them are used equally, but I mean, depending on the situation, sometimes it's only warranted to use the head tilt chin lift. Sometimes you will need to use the jaw thrust, or sometimes you might need to use the cross finger supply. But they're all, you can use any of them. Airway clearance. This is a suction gun or bottle. I pull the sandal in and it induces a suction effect. And everything that is in the pharynx and in the mouth, saliva, vomit, whatever it is, mainly liquids, they will be aspirated. Maneta, we removed them, we got them out of the body, and they will go into this. The power went off. يلا just 1 second عشان the power went off وهلا رجعت.